you all for being here today. Your beautiful faces, handsome faces. Welcome. There are lots of friends here today. All right. So when I sit up here, I have all these great pearls of wisdom. And then I get up here in front of you and I forget them. So today I'm going to practice looking at my notes. We were taught, when we were growing up, we're all taught to listen to our doctors, do what they tell us to do, right? Right? All right, well today is not to disparage that line of thinking, but it is to encourage us to ask questions. What do you think? Think that's right?
I completely agree.
Okay, all right. Dr. Terry had mentioned that too. He's like, don't be afraid to ask questions. So today is about understanding our bodies well enough to know when it's appropriate to ask more questions, when it's uncomfortable. And I kind of like to think about it as trusting our instincts a little bit more. So think of it that way. My name is Leanne Volta, and by day, Betsy and I, say hi to Betsy and I. By day, Betsy and I help families transition in times of change. And so we have a process that really takes into consideration that the stage of life that we're in and help support families through that transition. We came to this process because Betsy and I helped our moms as they were going through that. When they were in their journeys of aging, we had lots of questions. We got lots of little runarounds. We didn't really know where to go. And so that just sort of made us really listen for those opportunities to learn about in this arena, this arena of aging. We discovered firsthand how confusing all the mixed information is and all the information we can read online. And so we wanted to create a venue where we could come together, learn from our community experts, and then ask some questions that may be personal to us. So that's why we're here today. I do have some partners that help me in this because, getting the word out there can be a little costly, and they help me spread the word. So I have our education partners in the back of the room, and we're not here to sell you anything. We're here to educate, encourage, empower. But when you're doing that, you'd like to have a person that you may be able to call and ask questions. And so that's who you have in the room. You have people that are here to be a resource to you, not to sell you something. So I'm going to start in the back, and I'm going to ask our education partners to introduce themselves and just tell you what they do. But that's it, because last month we ran a little bit long. So I'm just asking quickly what your names are, your company name obviously, and tell us what you do, because I want them to come back and meet you at the end of the day. Kayla, you're gonna start.
Hello everybody, my name is Kayla Holmes. I'm with Indiana Estate and Elder Law. I handle their marketing. We work with powers of attorney, wills and trusts, things of that nature. So
Thank you, Kayla.
Hi, I'm Nikki Porter. I'm with Harmony Senior Relocation Services. We help folks when they're downsizing and moving to their smaller home.
I'm Katie Maynard. I'm with Barrett Financial. I help you analyze the equity in your home and how to use that for your next purchase or aging in place, whatever the case may be.
Perfect, thank you.
Hello, my name is JJ Nance. I'm with Home Instead, and our mission is to enhance the lives of aging adults, primarily through in-home caregiving and personal care services, wherever you call them.
Thanks, JJ.
Oh, and I'm Betsy.
I'm never going to forget you.
Yes.
After you give me a hard time.
Yes. I am Betsy. I'm with Leanne and Betsy's team and Century 21 Sheets. And what we do is that we help you downsize easily, and not only downsize, but move along with lots of services too. If you're too busy, we'll help you go through it.
I'm going to take a small pause before we move forward. Actually, I'm going to come back. So go ahead, Debbie.
Hello, I'm Debbie Culler, and I'm a store
Soren Financial, and we help people with financial advisory solutions as well as tax planning preparation. And we also assist with financial wellness, which is an area that supports individuals financially. And I have with me Matt from our investment team and Sarah from our marketing team. So thank you for having us.
Thanks for being here. You know, what I really like about Soren is what I've learned is when we're younger, it's all about store up your money, like just make a deposit. Like that's the hard part, right? Just to take it out and put it in the bucket. But there's another season of life when you have to spend appropriately and watch the tax consequences, and that's what I like about having a planner and the tax people working together. So I'm just now learning a little bit about that, but that's what I really like that. And then the health, once we start to get to a point when it's a little bit more of a struggle to age in place and handle all of the finances and all the other pieces, it's nice to have somebody like that resource to be able to use. So I just really appreciate that. So thank you for all your support, education partners, and all of the many emails that you put up with getting from me. So thank you. A little housekeeping, and then I'm gonna have the panelists introduce themselves. Housekeeping. On your chairs, you did see a pen, a little notebook so you can ask your questions. You have a flyer in front of you that has two parts to it. It's going to, it's so that you can share next week's topic, which is the adult children of aging parents. So it might be somebody you want to give information to. So next Tuesday at 4:30, what's the topic? Somebody tell me the topic.
The paperwork that protects everyone,
There.
legal planning before crisis.
Okay, this is excellent. And so while it's geared towards adult children of aging parents, it's all about that paperwork that you need to secure the next season of life, which is gonna be Kayla's boss, Jenny, and it's an interesting panel. Well, it's actually not a panel. It's me interviewing Jenny in 3 different roles next week. So you get to listen to an estate and elder law for an entire hour and then ask your questions. So if you've been here before, you probably already know Jenny. She is a phenomenal attorney. She's entertaining and she cuts through the fluff. So if you have somebody in your life that maybe hasn't started their estate planning, like one of the kids, send them. If you want to learn more, come as well. So that's next Tuesday at 4:30. And then I have the next flyer is for a month from now. That topic at 2. Okay, clear as mud. I'm still getting the hang of the 2 seminars, so bear with me. So okay. Without further ado, I want you to meet our panelists and get to know their faces because and smile at them a lot while they're talking to them, while they're talking to us, because I want them. I want them to really enjoy this conversational setting with you. I want to invite them back for other topics. They are experts at their craft, and so we are so very lucky to have them. So thank you for coming. And then I'm going to start with Pat, Dr. Healy, aka Pat. We're going to start with him first because he looks the most comfortable in his skin about introducing himself.
And I'm the closest too, right?
Yeah, he's the closest.
Yeah, so Dr. Pat Healy. So I'm a retired geriatrician. Who's ever heard of a geriatrician? 1, 2, yeah. There aren't many of us around. In fact, my wife and I started and ran the St. Vincent Center for Healthy Aging, which is aimed at specific needs of older population. We were the first 2 geriatricians board certified in the state of Indiana, so we're relatively new. We're now retired 3 years, but we're doing some education and outreach just to keep busy, keep my wife busy mostly. But basically, I just kind of talking around the room. You know, these are people that we need. These people that are here with us sponsoring this, because it's not just about the medical care. I'm really good at that, but I'm really interested in what are the needs beyond just the medical care. So I'm interested to see what kind of questions you have, because geriatrics requires a holistic viewpoint, more than just the medical. It's medical, psychosocial, functional, which I'm really glad to have members of the functional team here. Take it away.
Thank you. Oh, by the way, you are gonna get to meet his wife next month, so, yeah.
Be much better have. Stay tuned.
Well, thank you for having me. My name is Lindsay Bankert. I'm a registered nurse, and my role now is a nurse care manager. I am the owner of Solutions for Seniors, and in short, I help navigate the healthcare system for aging adults and their families. So I see it from a clinical side a little bit, and also just being in the home and understanding the needs beyond just the medical part of it.
Hugely important. Huge.
Thank you for having me. I'm Kim Starr. I'm occupational therapist. I retired 2 years ago after 30 years, but I still work 6 to 8 hours a week. And I am also going to turn 69 this year, so I'm right there with you.
Young
So
pup.
I understand what the whole aging in place is about. So, and fire away with any questions when we get there.
Thanks, Kim, for being here. Kim and I are also in the same study on Wednesdays, and as many of our friends are in there sitting with you supporting us, so thank you so much for being here as I dragged her out today. Okay, we were on the phone, we were on a Zoom call, Pat, a couple weeks ago, and I think I called you a gerontologist. Yeah.
That's
And-
forgivable.
So I guess I wanted us to learn more about that.
So geriatric medicine is the care of the older age patient. Gerontology is the study of aging, okay? Geron means old man, ology means study of the old man, very sexist there. But that study of aging, why we age, how we age, I'm involved in the medical practice of caring for older age patients.
Thank
Is
you.
that clear? But I've been called a gerontologist and I'm flattered, great, but I'm not a researcher. I'm practicing, or was a practicing physician. Now I just play golf.
They have a really neat website you'll have to go out and look at. It's
Healy's on aging.
thank you. Healy's on Aging.
What's that?
Healy's on Aging.
.com, although we don't make any money on it.
Well, they go out and educate the medical field on caring for aging adults. So, what a wonderful thing to be doing in your retirement years.
Like I say, keep my wife busy.
She's lovely. So, my first question is to you, Kat. What is considered normal physical changes as we age? What's considered normal?
Well, that's probably a whole seminar. And some people would say that, we can't define normal. Because one of the things about aging, if you think you have 6 infants, in 6 cribs right in front of you, they're all very similar. If you have 6 85-year-olds, they're very different, because a lot of things have happened. Normal aging changes, which are, we've discovered that through the study of gerontology, but also all life's occurrences and illnesses and function and everything else. They're very heterogeneous. So it's really hard to know what normal is. Now if you ask me what a normal kidney is with aging, I can spew off a lot of stuff that will bore you to tears. But one of the things about aging is, one, it shouldn't hurt. Right? Can't tell you how many times I've heard physicians, I taught a lot of young doctors, well, what do you expect of your age? It's just gonna happen. No, you're not supposed to hurt. Normal aging doesn't hurt, right? Not supposed to hurt. And that's probably the most important thing. But normal aging is silent. It happens without you knowing it. And it's a loss of reserve, a loss of resilience, and if you have enough insults from illnesses or functional disabilities, you become frail, okay? But normal aging does not lead to frailty, okay? My mom's 99, believe it or not, 99, still living at home independently. But one little thing, and it's all over. because she has used up, she's been very resilient until this point, but she has no reserve because she's been aging normally. She ages with some diseases. She's not completely free of disease. So it's a rare person who ages without disease. Very, very rare. And so she's aged with diseases, but she's managed to maintain function, managed to, get the resources that she needs. But any little thing, it's over. At 99, she has no reserve. So normal aging is a loss of reserve, a loss of resilience. So a little kid, you can have a horrible big surgery, a horrible big accident, and they'll survive it. People our age go in for a gallbladder and just go to hell in a handbasket, right? It's just a simple gallbladder. Well, if you've had normal aging and you're becoming frail, that gallbladder surgery may be huge because of normal aging, diseases, loss of function, all those sorts of things. So it's a huge topic, what happens in normal aging, but it's not a disease either. You get on the website, there's a lot of people making a lot of money acting like aging is a disease. We can't change aging, right? We start aging at birth, right? But there's a lot out there. I used to have a number of the websites. I used to quote it to my young doctors. It was 20,000 websites acting like normal aging is a disease. It is not, okay? It is a process, but it can lead to disease, right? Because people, the older you are, you're more likely to get dementia, heart disease, stroke. You are set up because of normal changes. I could go on forever. So hopefully that's a quick answer. It doesn't hurt. It doesn't hurt. It's a normal process. It's not disease, and we all go through it. But think 100 years ago, people didn't live as long as we did. They didn't get to see what normal aging causes because they died of pneumonia, diphtheria, diarrheal diseases, parasites, all that stuff before the invention of the toilet and antibiotics and vaccines. But now we get to live and see what normal aging can happen. But it's unfortunately medical science doesn't have an ICD-9, they know what that is, code for normal aging. So we code by diseases. So I'm board certified good at treating disease, but we don't know a lot about. As physicians, we don't know a lot about the normal changes that happen. You have to do extra training to learn that because they don't learn it in medical school. Not their fault. They don't know that. That's not a part of their education. At least it wasn't 3 years ago. I'm out of the business of teaching anymore. But yeah, normal aging, great question.
Yeah. And how helpful is it to know that whatever we're going through it shouldn't be painful. So if there's something painful going on,
That ain't normal.
There's something going on.
That ain't normal.
Okay. Which brings me to another question. What symptoms are often let me rephrase that. What symptoms are often incorrectly dismissed?
Well, I think there's a lot of symptoms that it's very easy to shrug off as a clinician. And fatigue is a big one. Mm-hmm. Is it normal to be fatigued? No, it's not normal. Now, if you've allowed yourself to become deconditioned and you have a few diseases, that may be part of your disease. If you smoked all your life, yes, you may well be fatigued. If you have untreated heart disease, you may have fatigue. You may have, but the workup of fatigue is very difficult because oftentimes the workup I do turns up nothing. Oh, it's in your head. Oh, you're depressed. It's very difficult, but in terms of the normal aging physiology, you should not have fatigue. All right? There is a reason for it. It's just sometimes we quit digging for it after we've sort of done the easy stuff, and often very difficult. So dizziness is a big one, but dizziness is often dismissed in a primary care office. To me, dizziness is a huge thing because that means you're unsteady on your feet. Right? Now, of course, the problem we have is dizziness and vertigo in the American lexicon, it's the same thing, but they're very different. Vertigo and dizziness. Dizziness is unsteadiness. Vertigo, the room spinning, I wish it would stop. But dizziness is huge in the therapy world, and for me, dizziness is something you would easily dismiss, but often means early frailty. So you bend over, you look up, you get dizzy or unsteady, or you go from sitting to standing and you're dizzy because your blood pressure drops because you're on too much medicine. You know, that needs to be worked up. So anyway, I can go on.
So that's frailty.
So frailty makes all this stuff more likely. If you are robust, hopefully I'm robust, you know, that stuff shouldn't be happening.
You're very robust.
I work out every day. But so, exercise every day, right? Every day. But as people get frail, deconditioned, these sort of symptoms really may mean something, but they're so non-specific that as a clinician, it's hard for me to tease it out.
So how many of you experience tiredness or exhaustion? How many of you? Yeah. Thanks, Kim, I appreciate that. So you're saying we should be teasing that out. We should be figuring out
There
why
is a
we're feeling
reason for that.
exhausted.
There is a
Yeah.
reason. Don't say it's your age, because
Okay.
it's not your age. Because, you know, someone raised their hand the same age as I am, well, how come I'm not tired?
Right.
Why do
You know.
so many doctors, when you go to them, they say it's normal?
They don't know where to
And they
go.
just-
They don't know where to go. They haven't had the background of what happens normally with older people. They're told that I know you by your diseases, and you don't do as well because you're old. That's what they're told. That's what they told me. I said, that's not good enough. But that's how they're trained. Oh, you're not gonna do as well because you're old. What do you expect because you're old, you know? So, I use the word ageism. You've heard of sexism, racism. It's based on lack of knowledge, right? So ageism, Medicare is ageist, is age biased. Medicare, CMS, age biased. The way they bill and they reimburse physicians is very ageist, because they don't have codes that indicate function, right? I mean, you can do it, but it's very difficult. And I've lied so many times to Medicare to get stuff covered. But we're not taught that in older people, diseases present differently, the treatments are different, you can overtreat quicker than you undertreat. So often the easy thing is say, it's just your age. What do you expect? You know, because my big thing is, you know, I have a bad left knee, right? So it's my age, right? Well, how come my other knee doesn't hurt? It's my arthritis, right? But oftentimes as physicians, we're not taught how to get over that. It's just your age stuff. It's still, it shouldn't be happening, but it is. It is. Now, those of you who are fatigued, how many of you are fatigued who exercise every day? Okay. How do you feel after you exercise? Pretty good? Keep it up. Go. Keep it up. All right. Yeah.
Thank you. Thank you. He's very passionate, isn't he? Awesome.
I know what you're talking about.
All right, I'm gonna ask Lindsay this next question. Now you know, right? Or like, make another call or ask some more questions. It's helpful, isn't it, to know that?
The information's helpful, but when you ask more questions, you're dismissed even more often.
Yeah.
Okay, I just have to jump in
Please,
here.
thank you.
Do not give up.
Yeah, I agree.
Do not give up. Look for a different doctor. I have fought dizziness, and I have an appointment with a neurologist like in August, but I've been fighting this for years and years, and exactly what he's talking about, reaching up, bending over. I know from doing what I do for a living, I gotta get a grip on this. We gotta figure out what's going on. You know, I've paid out of pocket for a functional medicine doctor, but there are doctors out there who care, you just gotta do the research. And if they tell you, well, just what it is, you need to look somewhere else. Talk to friends, find out, you know, who they go to, what they think of their doctors. Do your research online. Don't give up. Do not give up. My mom's gonna be 89. She got one kidney and a heart that is pacemaker dependent 100%. She lives alone on a farm, drives. I would drive anywhere in the country with her because she never gave up. She keeps going in. She has like 7 doctors, but she keeps going. You just can't give up. If they act like that to you, then you need a new doctor.
Oh, good, thanks, Kim. Thanks for that.
Except one thing. Does another doctor carry your insurance? Do they accept
No,
that?
that's another conversation we've gotten into.
That's
That's the battle. And that's why Dr. Dooley and I were diehard traditional Medicare fans, because then you don't have that issue. Like with the Advantage.
Yeah, there are a lot of hoops you have to jump through, and that's not right. You know, access should be open and available, and unfortunately, it's not. It's a business. I don't look at medicine as a business, but boy, it is.
Mhm.
So is rehab, right? A
Yeah,
business.
It's a
And
business.
That's not right. We're dealing with people. We want to help people, but that's the roadblocks are there. Yeah, I'll shut up.
Well, that brings us to Lindsay.
Yeah, she's got all the answers.
She's, no, I know.
I love case managers. There.
Right.
Because, I mean, we've been at this, Betsy and I have been at this for a little over a year, and there just seems to be a gap between those that know and the guests or patients or humans that don't know. And so I was like, who can help us bridge that gap? Just the, hey, mom and dad are going through this, we need help navigating that. And then I found Lindsay. Research. It took a lot of research to figure out who does that. And so we have Lindsay with Senior Solutions. And so Lindsay, I wanted to ask you, why do older adults hesitate to speak up?
Well, as she said, they feel dismissed, for one. They may not understand the right questions to ask. They think this is just normal aging, so that's the answer they're gonna get. Also navigating, even if you're trying to call a physician or an office, that can be difficult, so they just often give up. Using a patient portal can be difficult at times, and you don't get the response, or they're all different logins or different platforms, so people kind of give up that way. And but yeah, I think feeling dismissed is one, and then also they don't want to be a burden to somebody.
We feel that a lot.
Yeah.
I've heard that a lot, and I feel that way as a mom. Like, I just don't want to be a burden. I would rather learn how to do it independently
Yeah.
than be a burden. But that can get in the way of being more curious or yes.
But she's such an advocate, right? She gets it. The nursing background, they understand. I don't have that background. I'm medical. I know you by your diseases. I'm overstated. But I depend on someone who knows the system, who can advocate for you, who can speak the language. And I was never intimidated when a patient would come in my office with a case manager. That's, to me, that's so helpful because, I got the medical stuff, but that's not working. There's something else, and,
We fill in all the gaps.
they fill in the gaps and they do it so well.
I have a question.
You know.
I understand what a doctor is.
Yeah.
I don't understand what you do.
Great.
Yes, great question.
Speak up, come on,
Okay.
advocate
So-
for yourself.
Yeah, I stopped it. I met Lindsay, but I didn't really go on to say what you do.
Okay,
So, yeah.
so I'm a nurse care manager, and basically I help navigate. So if you're living at home and you have needs at home, or you need resources there, if you have a loved one, or you're had a surgery and you're going to rehab, navigating that transition, getting PT and other resources that you might need that are often overlooked, either at a discharge from a rehab or a hospital. I also help people with medication management. They are on a ton of medications and they don't know why they take them. They're not sure if they're taking them correctly, so filling those pill boxes and letting people know, you're taking the wrong dose, or they're not refilling them for whatever reason, because it's really hard to get a hold of a pharmacist. So just filling in the gaps with that and getting, I always tell people I call myself their quarterback. So I'm getting things together for you and navigating these difficult situations. Because when it's a crisis, it's already escalated to the point where, we want to be proactive and get things in place before it becomes that.
So when we're in crisis, we're in our brain stems, and we literally are flooded with emotions and cortisol, and we can't think rationally, and so we don't even know what questions to ask. And so having a quarterback who cares about us but is somewhat detached and can see what's going on is going to be in that position to help us get through that process.
It's a service you provide where you come into our homes.
Mhm.
I can
And-
go to people's homes. I have several clients that are in, senior communities.
Okay, just so whatever,
Yeah.
however we need you, okay,
Yeah.
okay, thank you.
But
Yeah.
how do we learn how to contact them? Because we don't learn it from the doctors.
No, and so I found out about it through researching, case managers was what I kept researching and asking in the computer in different ways. Because I just kept hearing case manager come up. I knew that case managers, like I knew the hospitals had like discharge case managers. I have girlfriends that do that. But what I was looking for was someone who was outside the hospital system that could be more of an advocate for us as opposed to for the hospital. Like the discharge case managers, and I could be overstating it, is they're trying to help you get home and get what you need at home, but kind of get you out of the hospital.
And they're done.
And they're done. And so I wanted to find out if there were people that actually could advocate for us.
Yeah.
And so that, I found you on a particular site that you belong to an organization.
Aging Life Care Association. So
What?
it's Aging Life Care Association. So they have, it's across the United States. They have, a website, you can go in and put a zip code in and find someone that's near your zip code, and
That's how I found you.
there's a lot of us, yeah.
And then once I had that, I was
There's
able
not
to.
enough of us, I should
There's
say.
not enough.
Yeah.
Cause I found the closest
Yeah.
one to Zionsville. I figured,
Mhm.
okay, Lindsay is in Zionsville, she's more likely to come out and support us. Again, finding those local resources for us. And, found out that, yeah, there's, and she has no one size fits all. It sounds to me like all of her clients have different needs.
Yes.
And she's trying to put that all in her schedule.
Yeah.
She serves a friend of mine who is aging in a memory care community. And then, so, yeah, she does a lot of different things, so, yeah.
So just give you an idea, in my office, we had two nurse case managers. And case managers can be nurses or social workers. I favored nurses just because of the nursing background, but we also used outside case managers. There was such a demand, such a need, but the problem is nobody realizes they need it.
Right.
And when I first suggest case management, they look at you like, you what? Like it's, deer in the headlights. What does that do? Because your question is a very good one. What do they do?
Yeah, I didn't-
Right,
I
and
didn't-
I often spend a lot of time explaining what they do, why you need a case manager, because it's often in crisis. But, you ought to get it before they're in crisis if you see an emerging need. So, our office was kind of really different, but we had we still have two of them. And I could not have practiced without them, absolutely no way. Because I can handle the medical stuff, and it's like, what about the unmet needs? Because you knew in the room there's an unmet need, and I'm not skilled enough to tease it out, but if I had ready access to Lindsay or people with the same background, then actually I have a much happier patient and family when those needs, because it's not, as you get older, it's not just medical. You think the doctor's got all the answers, he or she doesn't, or the nurse practitioner. I love nurse practitioners, by the way. We had several of them. And so if you have a nurse practitioner, embrace him or her. They're incredible, they have more time, they have that nursing background, which is essential. Because in geriatrics, it's not just medical, it's medical, psych, social, functional. It's the whole package, and you can't do it right, you can't age well if one of them's out of whack.
Yeah.
Agree?
Agreed.
Dr. Healy, if you're no longer in clinical practice, are there practitioners out there who think about these things the way you do?
Yeah, there are. So we
I'm
train.
asking for a friend.
We train several. They are out there. There are not many of them.
How does one look at that person?
How do we find?
Well, the Center for Healthy Aging was where I came from, St. Vincent. But Community North, one of our fellows, runs the HATS program. I forget what HATS stands for, H-A-T-S. Patient, speak it loudly.
Healthy
HATS.
Aging Transition Services.
Yeah, so Community has, and then of course Wishers, which probably not really work, but these folks would go, but they had a senior care clinic that was modeled very much like ours. We kind of set them up together. We kind of worked together, Wishard and St. Vincent, on setting that up. So, but there aren't many of them.
Is there something that St. Vincent did you say?
Yes, Center for Healthy Aging. I hate that name, but it takes care of older people. Center for Healthy Aging, we don't see healthy people. That's not why we're there, even though that's our name. I didn't choose it.
He said he didn't choose that.
I didn't choose it.
I was gonna add to your question, so I had a client the other day that fell at CVS, went to a community ER. He was there, he couldn't really advocate because he was somewhat out of it and didn't recall all the events. His family was there, then they called me. I had already had him for over a year now, and, but he didn't realize he had follow-up appointments, no one made those for him. He didn't even have really the reason why he was in there. He couldn't recall these things, so I took him to the cardiologist and I was able to provide the story, give him the community network. I pulled it off their portal and just gave him the whole story, so then we could start from that, where he could not articulate any of that, because he really didn't understand it. And, he had med changes prior to that he didn't even recall. So there were just a lot of different gaps that he couldn't bring up to the physician that I did, and it went smoothly.
That's wonderful.
Thank you.
And again,
That's very
this is
helpful.
why we do these seminars, so we can learn what resources are out there and bring them, because to me, especially if you're aging, if you're a solo ager, you need a Lindsay on your team, so.
Yeah, the resources are out there, you just,
Yeah,
finding
just
them,
gotta
you
find
have to
them.
have a lot of savvy and experience, and, you know, a family member in crisis is, you know, they don't restart. They just,
Lindsay, are you covered by insurance?
I am not. I'm private pay.
worth every penny.
If you do have, long-term care insurance that covers, care management,
Oh,
then I do have a couple clients that get reimbursed for that.
okay, thank you.
Lindsay, what kind of questions should we, ask our providers? Are there any that you think we don't ask enough of, or recommendations?
For sure. I would say, depending on the diagnosis or the disease, you know, what are my options? Why are you prescribing this medication? What are the side effects? If I'm going down a treatment path, what does that timeline look like? Do I need referrals? Do I need to see other specialists? When will I come back? Yeah, just asking all the questions.
Taking notes?
Yeah, taking
Having
notes.
someone taking notes for us?
Yes, if you have someone that can go with you to an appointment that is willing to be your eyes and ears, that's huge, because it's overwhelming hearing all these things.
And
then
you're like,
you
I
go
don't remember
home-
that.
You go home and you forget, or, you forgot to go get the lab that was ordered, or you didn't pick up the medication, or you're not taking the medication correctly. So there's tons of questions that can be asked that oftentimes, some, not all, physicians think you speak it so much, they think they understand it, and really, they don't, cause it's, we say it all the time, but when someone doesn't have those,
Yeah,
health
we
background.
throw a lot at them without really realizing. A lot of
Well, you only
buzzwords
have a
and
limited amount of
Yeah.
time, yeah. I mean, unfortunately, it
Roadblocks.
is, yeah.
Roadblocks to good care.
He's like, I don't even
Yeah.
care, it's a roadblock.
Hamster wheel, get them out.
I
Hate that.
I wanna backtrack a little bit, because you talked about exercising every day, and I think that's right up Kim's alley. Kim, I wanna go back and ask you, how does strength and balance change over time?
Well, first before we start, how many of you know what an occupational therapist actually is? How many of you know what a physical therapist is? Everybody. Well, a physical therapist, they're gonna work on your strength and balance and your biomechanics. Occupational therapists, we're gonna translate that into functional mobility and activities of your everyday life. Going to the bathroom, getting dressed, taking a shower, cooking, doing your laundry. You need all that PT does, but they're not gonna teach you how to do all that, but they're gonna help get you there. And we collaborate together, but as an OT, we look at the big picture, very holistic approach to everything. But, so back to what she was saying, you start losing muscle mass in your 30s and 40s. And you just gain, each decade you start losing, you lose more and more, and in your 60s, living proof of that, it really hits you hard. That strength really starts to go. So it's gonna be real important as you age that you stay active and moving. I mean, every single day you have to move. I cannot say that enough. And also resistance training. So, it can be light weights, bands, anything like that. You've seen the classes for senior citizens, any of that. Walking every day, if you can walk 30 minutes a day, it doesn't have to be at one time. You can do it 10 minutes here and 10 minutes later, but every single day it's important. And the saying, use it or lose it, is never more important than it is as you age. And it takes more effort on our parts, it really does. Try and make that fun too. There's classes out there, the fun classes, Silver Sneakers offers that. I know a lot of the churches offer it. There's a lot of community of it. You just have to Google it. The library even offers it. I don't know about this library, but I know Indianapolis libraries do. So look into those activities. There's another question you have later on.
I
that
do,
I'd like to-
I was gonna ask you, what signs suggest that we need, some mobility support?
Well, and some of you may recognize this in yourself or others. I got a whole list, but.
You may have a friend who has these symptoms.
I have to write this down. I'm not like Dr. Healy. I start talking and then I forget what I'm saying.
Well, Dr. Healy did say, as long as you can find your way back on track, it was good.
You're all right.
You're all right.
So, fear of falling, if you notice you're walking slower, shuffling your feet, that's a big one.
That's that shuffling of feet.
Yeah, just when you're walking, we've seen people
Yeah.
shuffle, or your shoes are dragging when you're walking, you're not picking your feet up.
Falling upstairs.
Yeah, avoiding stairs, holding on to rails and walls. I have a lot of patients that do that. Oh, I don't need anything, I just grab the furniture, I grab the wall.
Furniture walking.
Furniture walking.
Furniture
Yeah.
walking, yeah. Drinking less. And you're thinking, what? Because they don't wanna get up and go to the bathroom. I see that all the time. Drinking less is one of the worst things I see happening in the, long-term care facilities, because that affects your mind. You need to drink plenty of fluids to keep your mind sharp and to keep your body moving and to flush out all those toxins and everything. So if you're afraid of falling or it's too much effort to get up, you stop drinking less because you don't want to have to go to the bathroom. That's a big one to think about. If you see decreased participation in social events, it's just too hard, it's too much effort, too much work to go out. These are all things to consider. And that brings me to the importance of PT and OT. You really need to see it, when you start to see these things happen, talk to a physical therapist, get into a therapy clinic, have your doctor refer you if you need to. Because what I see happening, and this is happening in my own family, my own aunt and uncle, they're using walkers because they just don't wanna have to deal with going to a physical therapist. And I see that so often, people are like, well, this is working okay. So they continue to deal with pain and mobility issues and increased fall risk because they just don't wanna go to a physical therapist. Like I said, I'm gonna be 69 years old. I right now see a therapist once a week. I've seen a therapist for every body part I have over the last 15 years. I've had my share of surgeries and hip surgeries, foot, Achilles tendon. I'm going out fighting. I'm not going out quietly, and that's what I recommend to all of you. And if you can't find someone to go see to help you with this, call her.
Hey, an example of normal aging. So between age 30 and age 72, my age, I have lost, through no fault of my own, 50% of the muscle cells I was born with. Gone, lost, gone. So I have to, we call hypertrophy. I have to make the cells that I have bigger. which is why I do resistance training every day. Now, I was a runner. I ran every day for 30 years until my knee made me stop. I never even looked inside of a gym because running was all I needed to do. Endorphins, exercise, you know, my VO2 max was tremendous. But once I had to quit running 5 years ago, I said, you know, I have got to face the fact that I am weak because I need to work on my muscles. So I now do resistance training every day, 3 times in the gym, you know, 4 times at home, because you have to overwork the muscle fibers that you have, because I have lost a tremendous amount of fiber. So people that shuffle, they shuffle because they can't pick their feet up, okay? And, you know, one of the interesting things is, you know, I've got a 1-year-old grandson, my only one, and he's just starting to walk. So he's very wide-based, little bitty steps. His arms are like this, right? Think about older people as they decline, they go back towards my 1-year-old who's just started to walk. Their stance widens, their gait, you know, their, what's it called? Step length, small, so they're shuffling and they're wide-based and they're like this, you know, grabbing onto things. So you kind of go back the way you came. You need to fight that. You need to, you know, do whatever you can, whether it's, you know, bands, whether it's weights, and it could be wimpy weights. It doesn't have to be, you know, I was intimidated 5 years ago, you know, all the guys in their spandex, you know, and here I am, this wimpy, skinny runner who never ever wanted to be in the gym. I was scared to death. But I got some training from a trainer, and I can now go in there, skinny old me, doing resistance. I've got to keep my muscles going because, you know, if you look at prognostic, you know, there's a better than average chance I'm going to live 15 years. You know, when I'm in my 80s, I want to be able to get off the floor, you know, or play with my grandkids, or be able to walk as far as I want and stay home. My God, stay home. You know, I don't want to go to an institution. So, you know, I exercise every day. Again, I'm kind of a freak because I kind of understand that, you know, the aging process, and I've got to do whatever I can to sort of retard, you know, the weakness that's going to happen because I'm losing muscle. I can't help that, but I'm building up the ones I have. Is that helpful? Is that helpful?
If you're on the internet, you can research things to do at home. They can be as easy as just a simple squat, holding a chair. If you don't feel comfortable doing a squat, you can just start low. I can't go down like I used to anymore because then my knee kills me and then I can't do it at all. So, you know, you can hold the back of a chair and do a simple squat. You can do a simple wall or countertop push-up. You know, I can't do regular push-ups anymore because my wrist and hands don't let me. But there's all kinds of exercises you can do out there. Start with a bottle of water if you don't have weights. I mean, those bands you can buy, and there's so much on the internet. So much on the internet. But try and make it fun. Try and find a group. There's always a group
It's so much more fun when you do it.
Yeah,
with
it
friends.
is more fun when you do it with a
And
group.
we need socialization as we get older.
Well, that was the other thing.
That's the nursing thing, right? I mean, you know, cognitively, we need people. I'm a loner, and I still need people, right? Because we need to be pounding off of other people. We're social beings, even though I'd like to just crawl in a hole and ignore the world. You know, we need that. And people who age well, one of the big things they do is they are connected with other people. They have a raison d'etre, reason for being. Little German there? Or no, Latin. Raison d'etre. Reason for being. So that's incredibly important.
Can I add something to that?
Yeah, please, Marilyn.
Yes, yeah. There are lots of things on the internet, and you have to be able to pick out what's appropriate for you.
Yes.
Yeah. And, you know, I'm gonna refer back to my former profession, but there are also exercise therapists that can help. But, you know, trying to get something that's individualized for you. I mean, you know, you say, well, get some of those bands. Well, I mean, they might give you the level 3 and you're going, oh, I can't pull that, you know? So I think it's important to go back to occupational therapy. I'm a former physical therapist. And
Yeah, you're
there are
exactly right.
very few geriatric physical therapists around. I think most of them do work a little bit more with balance and those types of things around nursing homes, but it's that in-between age, like you say, where you've lost your muscle mass. And, what do I do now? But I think there are some issues with, payment, with Medicare. Well, you have to have a diagnosis here, for us to pay for that.
What's interesting now, there's a new thing with CMS. You can see a physical therapist without needing a diagnosis.
Yes.
You pay for it, worth every penny, because they'll assess what exercises you can do. You say, I want an exercise program for my level, age, fitness, whatever, and they'll do that for you,
Injury,
right?
how many people have shoulder injuries that
Oh
are
my
outrageous?
goodness.
I do,
Just make up one, so that gets paid for.
So
If you said, I fell, I fell and this happened.
What's
Send me
CMS?
physical therapy.
Oh, CMS, that's Medicare, Center for
That's
Medicare
right.
Medicaid Services.
Yeah,
C-
you
CMS
also-
pays the doctors, and the nurse practitioners,
Yeah.
and they have a coding system, so that's what you're referring to.
Yeah,
But, I mean, I've gone
That's
physical
good.
therapy and just said, hey, my knee hurts. I mean, and that's all I need, but
They'll give you a
I,
discount that if you pay cash
Yeah,
too, if your
yeah.
insurance won't cover it.
yeah, I mean, I just pay cash, therapy is absolutely essential, because they can assess you they know more about, joint exams than I've
Oh, same.
ever known. But it's worth it, just put your cash down and say, all right, I need, the other thing you do, go to the Monon Center and hire one of those fitness people, and pay them and say, okay, what kind of things do you recommend I do? And just get started, right?
They can set you up with a program that you can do at home, and you don't have to keep paying them every week.
Oh, yeah, right,
They'll
right.
set you up, see it
Right.
2 or 3 times,
Right.
and make sure you're comfortable with the program, and then you can take it home, and then maybe in 3 months or 6 months, go back to them and say, hey, maybe we need to upgrade this, But at home, the best thing you do is keep doing what you love. You like
Yeah.
to garden, get out there and do it.
Gardening is exercise.
And just
Oh, I'm
do me
feeling
a
it
favor,
these
do
days.
not buy a lift chair. Do not buy a lift chair.
No, lift chairs are awful.
Lift chairs are horrible. Do not buy a lift chair. They're
Did you
not,
guys hear that?
they are
Don't
not
buy
your
a lift
friend.
chair.
Even though Medicare will pay for a part of it, no, don't do it.
You
And
just
it's
lose
not
your
just the
legs
Monon
for it.
Center. All of these gyms, don't be intimidated by the spandex crowd like I was, okay? I mean, they have wonderful, trainers.
Yeah, also, at this library there,
Hey,
there's
ladies.
senior yoga.
Terry.
Love it.
Yeah, senior chair
Love
in
it.
yoga every other week. And she's an excellent instructor. You don't have to do everything she says,
Right.
but it's 15 to 20.
Now, if anyone has access to Tai Chi,
I was just gonna say.
okay, go ahead. You
No,
know about that.
no, go ahead.
But
You're
I
right
was,
on it, yeah.
I was taught medical students and residents, if there's a functional question and the answer is Tai Chi, answer it for old people. Because it ticks so many boxes for the kinds of things old people need. Balance, dizziness, gait, and the range of motion, on and on.
Perfect. Tai Chi
But
is perfect.
That's
for
the
it.
answer. If Tai Chi is one of your answers, answer it for an old person.
If you
Tai
have
Chi.
Facebook, you're getting inundated with very good, reasonable Tai Chi exercises.
Everybody can do them.
Yes.
The only thing about that is you're typically alone when you're doing that, those online.
Doesn't have to be.
Yeah, but, I'm like you, I'm a loner. I'm very social, I talk a lot, but
But I'm
I don't
acting.
mind being
I'm
alone
acting.
when I'm doing exercises, but I had cancer, I survived it. He, got me a gym membership and paid for a personal trainer because I was having balance issues. And it was expensive, but you don't need a personal trainer, as she said, every week, every day, and what have you. I used it because I needed somebody to motivate me. But that personal trainer was important because he told me, don't use this machine, don't use that machine, use this instead. And when I joined the exercise class, I was no longer paying him, but Chris kept an eye on me, and he said, don't do that. It's not age appropriate.
That's very wise.
And what have you.
Very wise.
So, just if you use a personal trainer or an exercise expert to get you on a program that's appropriate for you, it helps. Because I was using a couple machines that, boy, they felt good, and he said, don't do that.
She needs to get up here.
Yeah, definitely.
You sign her up.
I have a few more questions and then we're gonna open it up for the, our guests. I did wanna ask, Lindsay, how can families support, or how can they partner with you in this without taking over?
So I think if they're able to, like I said earlier, attend an appointment, with your permission, it really provides the extra set of eyes and ears to really take notes and continue to help following up. And while you're at the appointment, you should be the one that's speaking up, and they should be filling in the little gaps, but the provider's there to talk to you, and then they can provide oversight if there's something that maybe you forgot or whatever. And then, let's see. I did take this, I wrote notes down, sorry. I guess really the role for the family member is just to provide, ask the questions that you might have forgotten to ask. Follow up on the things like labs, the medications that we were saying earlier, and then just trying to understand and advocate for you, but allowing you to have really the role of speaking for yourself, but they're just there as an extra item there for you, so.
And I guess I would echo that too, is to go ahead and write down your questions, invite your family if you want them to go with you, but to set that expectation with them. I want you to go, I want you to be a part of this, but please let me ask the questions. You know, it's important that I continue to own my journey. So I just think sometimes it's easy for us to let someone take on that role. And I just wanna encourage you to keep control of that. We already want control. We already really wanna maintain that control. And so I just wanna encourage you in that to maybe write down those questions and invite them, but don't let them take over.
And also I think.
Don't let them boss you around.
Also, I think too, you may not realize, like she was saying, maybe you don't realize you're shuffling your feet. That's something that they can see. Things like that you may not even be have that self-awareness that a family member can speak into a little bit, so.
Yeah, thank you for that. I want to, before I open it up for our guests to ask questions, I just wanted to see if there's a last little thing you didn't get to say. I guess one thing I heard loud and clear is keep the exercise up every day. Find something that you enjoy.
One thing I would recommend, start looking at your house now.
Oh.
Start looking at your house now. I bought my house 20 years ago, and the first thing I said, I don't want one step in that house. When I redid my bathrooms, I put handicap height toilets in. When I put doorknobs in, I didn't put the kind like this. I put the kind with the bar that you just lift or raise. Start looking at your home. Start looking at your rugs in your house and cords and where you're storing things in shelves. Are you having to reach too high? I mean, there's so many easy fixes that you can make that will keep you in your home longer. And that's just a few things I'm naming, but if you're not sure, find an occupational therapist. They'll come in and do a home assessment for your house and give you some suggestions. I don't do that, but I have done 1 million home assessments with my patients who were getting ready to go home from rehab. And we've gone in and made major changes, but they were able to stay in there. You just need another set of eyes sometimes.
Good, thank you. We talked about that, didn't we? A little bit last year as we were wrapping up, adjustments to make if we were modifying our homes, and maybe even if we were constructing new homes, what to do differently. Yeah. Lindsay, any last words of advice or wisdom?
I would say be prepared and plan ahead. Don't wait till the crisis happens and then you are in crisis mode, and like you said, you just don't think clearly, or the options aren't there that you might have if you do plan ahead, so.
Good, thank you. Plan ahead. Yeah.
So aging ain't for sissies.
I have a comment. I've been going to the gym for over 50 years.
Good for you.
I was one of those guys, you know, I used to be pretty buff, you know, but you know, you lose some of it. I'm fixing to be 79 next week, so, and I haven't stopped, and I don't get
Good for
tired,
you.
and I don't drink, and I don't smoke, and haven't for a long time. And I've tried to help people exercise in the gym, but it's pulling teeth, because I've been doing it for such a long time, I'm used to having a block of time during the day, every day that I do this thing. And I don't like it when I can't do that, but getting somebody to put that block of time in their day, it's very difficult. The motivation, the initiative isn't there, and that's one of the things, the other thing that goes along with aging is the initiative tapers off, goes away. And so, and I can't make somebody do it,
No.
and somebody, unless you have a partner who really wants to make you do it, you're not gonna do it. That's really hard, that's an obstacle to this.
No, that's, I mean, truer words have never been spoken, and, you know, one of the things that we need to, as a profession, all of us in the health profession, is if there's one thing about aging, if you know, we always say we fear, what is it? We want a long life, yet we fear old age. We have to combat old age, and if there's one thing, it's not vaccines, antibiotics, diet, it's exercise.
Right.
Exercise is the number 1, 2, and 3 most important things if you want to be active in your old age. Okay, it is so important. It is number 1. I mean, you go on the websites, you know, the ones that you can trust. Exercise is the number 1 thing, and it needs to be a part of your day. And I always talk about 30 and 40-year-olds in their spandex. It's more important for us to be exercising because we don't have the same muscle mass. We are more dependent upon, you know, hypertrophying the muscles that we have. And truer words are never spoken. You know, and one thing, you know, as you get older, you know, we're living longer, much longer, but we're not living better. Right? So our healthy lifespan is getting smaller, and yet we're living longer, especially females. And an awful lot of it has to do with exercise. So, you know, he is dead on right, but it has to be a part of your day and make it a part of your day. And I'm retired for 3 years. It's like, now my job is to keep myself in as good a shape as possible because I want to be in good shape when I'm in my 80s, you know? So yeah, number 1, 2, and 3, exercise. Whatever you can do based upon, you know, I can't do a lot of things because of my knee, but I'm still pushing it because I'm postponing my knee replacement. Because I ran on my knee too long.
I'm still working, that's the other thing.
Yeah.
And I socialize several times a week, but, if I don't have work, my work is always like this, I'm a healthcare provider too, and if I don't have a lot of work, it's the devil's playground, you know, and I got something to focus on.
You need to have a reason. You need to have a reason, yeah. But yeah, it takes initiative. You have to do it, and you can't just say, my doctor says I'm healthy, that's good enough. No, because you don't have a disease that they can treat, your blood tests are normal, but you're a mess, you know, whether it's physically, socially, psychologically, whatever. Okay, I'll show.
No, that's good. That's good.
I love the forum. I love being able to expound on this stuff.
It is. It's just a conversation. Questions. Yes. Yeah.
I stopped working a year ago. Yeah, a little less than a year ago. And during that time, I didn't have any downtime during the day, and I felt fine. I kept going like a little engine. Now that I'm retired, I get real tired, and I wanna fall asleep around 6 p.m. I'm wondering if I was thinking, I was talking to myself, I thought, okay, I'm gonna change it and fall asleep, take a little nap around noon, so I can still fall asleep at nighttime. As I get older, people say, don't feel guilty about taking a nap. I feel real guilty about taking a nap. Is that normal for old people to take naps?
Okay, so like everything else as you get older, sleep is not as efficient. So you don't get the deep, healthy sleep that you did when you were younger. And it may take longer to go to sleep, but your total time in bed should not be any different than what it was when you were 40 and running around like crazy, okay? So if you have, the 7 to 8 hours, that's all you should be in bed. a nap after lunch, no more than 30 minutes, okay, that's fine. But if you're in bed 10, 12 hours and you're napping, something's not right. Maybe you've got sleep apnea, maybe in fact, you should not toss and turn in your bed. People, do not toss and turn. Get up and go do something. That is unhealthy sleep, but it's more common as you get older. Sleep is not as pleasurable, as satisfying, as efficient when you're older, but you need to stay within the sort of 7 to 9 hours, but a little nap after lunch, 30 minutes, no more, is fine.
Thank you, that's what I want.
Because what happens is when you take that nap is you go deep real fast and you come right back out of it. But what you don't want to do is stay in level 1 and 2 where you're kind of tossing and turning. That's not good. So bed is only for sleeping and sex. Okay, it's not for tossing and turning. Okay. Sex is fine.
So,
Alright.
it's good exercise.
I can talk about that one. Okay. Yeah.
Thank you.
Is that helpful?
That's very helpful.
Super good. That's good. I learned a lot, like tossing and turning.
But if you're falling asleep driving, falling asleep in the middle of a gripping novel, maybe something else is going on.
No, I get a good night's sleep,
Okay.
so long as I don't sleep late in the afternoon. My question was, is it okay to even take a nap? Because
30
I'm
minutes.
used to going,
Yeah.
and now all of a sudden, now that I'm retired, I feel like I need to take a nap.
Yeah. Get a job.
I think about it, I still think about it, I should go back to work. but I
Something you
don't.
enjoy, yeah. Beth, who's in Hawaii, that you guys might have met last month, is gonna start coming and helping, cause we just need a little bit more. But she's retired, and, just having something to do is, something that means a lot. Just, something she enjoys, something you enjoy.
Well, I have a whole list of things I wanna do. I have activities I wanna do, I wanna put together a flash mob.
Okay, a flash mob.
Flash mob, learn the
Count
guitar.
me in.
I like you.
And play
You're
guitar.
fun.
And learn the guitar, play the guitar, I've got stuff to do. And I've worked my whole life, and I could work again, but I'm like, no, do the things you wanna do.
Oh, yeah.
Absolutely.
Definitely.
Absolutely.
There are a lot of volunteer activities. My husband and I volunteer through our church at a food pantry on Crooked Creek. And, this last week on Wednesday, a crew of about 12 members from our church worked outside. It's, a mobile, where cars drive through. Well, some of us pack the grocery carts, some of us load the cars. We did 340 cars
Oh, wow.
in 3 hours.
Wow.
And they were expecting to do another 300 that afternoon. But our team is in reality made up of people from their 70s to their 80s. Bob and I are both 78. And by the time our 3-hour shift is done, we're tired.
That's okay.
It's a good tired. It's a good feeling.
Yeah, you don't have as much endurance. You cannot do what you could once do. And that's okay.
Because it goes back to that recovery, right? You said we don't recover.
It takes much longer to recover, much longer. Also just if you get a cut on your arm, your skin doesn't repair itself. It's like, 2 or 3 times slower and more likely to get infected. You don't have that reserve that you used to have. But yeah, good tired. I like the good tired. Yeah.
Yeah, it is good tired.
I really appreciate, Kim, you said, like, even if maybe we are having a knee problem, but to go ahead and find a different way of getting that exercise in. So,
Yeah, and see a physical therapist. I'm an OT, I'm more, I'm a street smart therapist. You come in a hot mess, you've been run over by a train, I will get you home. But you come in with a shoulder injury, probably not your girl, I've worked with a lot of shoulders, but, physical therapists, I swear by, like I said, I've been seeing physical therapists on and off for 15 years. You've got absolutely nothing to lose, nothing. If you wanna stay upright, and they can help you with these exercises and tell you and teach you ways to exercise that won't bother that knee or get that knee better so you can exercise.
Yes, Cindy.
What's your opinion on water aerobics?
Water
I like-
aerobics?
Fabulous,
Absolutely wonderful. Especially if you've got bad joints, yeah.
yeah. Highly recommend. Didn't even think of that one today.
Yes, sir.
Yeah, that's a
The
good.
cost of medical care is an issue, for older people because we're no longer working, don't have an active income anymore.
Yes.
How can we go to physical therapists and ensure that Medicare will pay for it? Do we have to have a doctor's recommendation?
Yeah, I mean, you can do the workaround if you are willing to pay the whatever, $100 it is. But yeah, what you need to do is get your doctor to put an ICD-10 code, a number on it, then Medicare covers it, right?
Okay.
Yeah.
So you say, in fact, you can go to the doctor and say, I need physical therapy because I got a bum knee and I can't get around because of it, I'm afraid I'm gonna fall. Bingo, there's all kinds of codes that doctor can then use for physical therapy. And of course, I was really creative. The faster I get someone into rehab, PT or OT, I would say anything.
Right.
But back to what we talked about,
I did.
insurance is different than it used to be. All these Advantage plans, like, we have traditional Medicare with a supplemental. So other than my initial yearly, I think $280 deductible for Medicare Part B, I pay nothing, everything's covered for my physical therapy. But I know for a fact on some of these outpatient, these insurance plans on the outpatient, you will have a copay. So you just have to check with, you can check with your insurance company, but you can also call a therapy clinic and they will run your insurance and tell you what you're gonna owe
Okay.
before you ever start.
So we also have supplemental, both my wife and I, and it's wonderful.
You have
So you're
traditional
in
Medicare?
Standard Medicare?
You have
Medicare
traditional, not Medicare Advantage.
Shouldn't be a problem.
Yeah,
Shouldn't be a
No, it's not
problem.
Advantage.
yeah, well, see,
Yeah.
that's what I have, and I'm covered. I had to pay my $280 deductible,
Yeah.
which got broke up these several appointments and that, but now I pay nothing for physical therapy.
Yeah, if you have a Medicare Advantage plan, it's harder to get physical therapy. But most doctors, in my experience, will work with you. But yeah,
But I
it's
still
much-
need to go to the doctor first. I can't
Yeah,
just
that's
walk
the way I
into it.
do it.
You have 41 days, but most I just looked this up for a friend of mine yesterday. You can have PT for 41 days until you absolutely have to show a script from a doctor. If you've seen your doctor recently and call them and say, hey, I wanna go see PT, will you send a script over? They'll do it.
Okay,
It's not that hard to get a script from a doctor for therapy.
just call them up and they'll do it.
Yeah, and
Yeah,
if
most
they
of
won't do
It's gonna
it,
depend
you
on
need
your
a different
doctor.
doctor.
Yeah. Good.
Yeah.
It is gonna depend on your doctor.
Okay.
So, just keep that in mind. That's it.
So what I'm hearing is, when you're talking to banks, we have people saying the key words, you have to say these words and that would trigger. So what I'm hearing is to get a physical therapy referral is either I'm afraid I'm falling, I'm too weak and I think I'm gonna fall. Those are words that you have to mention
sore
for
joint.
habit.
Shoulders frozen up,
Pain, okay.
Pain, oh, pain, yeah,
Pain.
that's a big
Yes,
one.
Pain,
Yeah.
pain.
Do you still have to set your functional goals? Because that's what I always used to tell my patients, but that's been 15 years ago. That, I cannot get up out of my chair. I cannot, reach my dishes.
They're still functional.
You used to have to set those functional goals.
Yeah.
And because I know the last when I went to a PT, she asked me if I could still vacuum, and I go, I don't have one of those vac maids. I don't do that anymore.
I had a gluteus medius muscle tear repair, and I could do anything I wanted to do, except sleep. The pain was so bad at night, I could not sleep in any way, shape, or form. And when the surgeon said, "What's your goal for the surgery?" I said, "I just want to sleep again. I just want to sleep again because the pain was so."
But for therapy, I mean it's
But it's a
issue
pain.
of
As long as if there's pain, that's a goal. I mean, any pain's gonna.
Okay.
If you have pain, I literally have a pain in my butt. Literally, I've had injections. I cannot sit for very long. Like I so want out of this chair right now. And that's what they see me for. I have this pain, and I can't sit very long. I can do anything I want, but it's miserable to sit.
So just a pro tip, if you had a fall in the last year, that's a physical therapy.
Absolutely.
That's physical therapy. If you had a fall, like in your Medicare wellness visit, you've had a fall in the last year, bingo, that's PT. All right, and then you'll get on the proper regimen, because they'll figure out why you fell, and then, you know, and try and
What
prevent.
if you're just clumsy?
Well,
Who has not had a fall in this last year? I just gotta ask now. You've not had a fall?
I'm not having fun.
Not a fall? Lois, no fall?
Leanne, you need physical therapy.
Sometimes I think I need speech therapy.
yeah. Get on an exercise program, huh? Right?
John wants to work out a trade.
No, I'm not gonna train you.
Thank you.
Yeah,
Any other?
but we like to deny the significance of a fall. And your Medicare wellness visit, that's one of the questions they always ask you. And that's an automatic PT referral. If you need it.
And chances are, if you have pain, it's affecting some form of function.
Yeah, right.
If you have pain that you're complaining about, it obviously is affecting some form of functioning.
Yeah. That's my biggest takeaway today is I should not be in pain. And I shouldn't be tired, exhausted. So that's really an eye opener today.
Or you can take a nap for 30 minutes.
Yes.
30 bucks.
It depends on how active you're staying, because there is legitimate tiredness.
Yes.
Oh, yeah, absolutely. Oh, yeah.
Because I still do a lot of gardening, and I carry 20 to 30 pound bags of soil and what have you.
Can you come to my house?
Right? Can we do this together?
Gardening is
That's like
exercise.
the commercial, what I do for myself is okay, but what I do for you is priceless.
Very good, very
That's
good.
awesome. That's awesome. All right, I want to mention a couple more things. Well, any last questions for our panel? All right, when we were all introducing ourselves, I had asked Sydney if she would help me with registration today. And so she's not getting out of introducing herself because we only have you for a few more minutes. So, Sydney, will you introduce yourself?
Hi, I'm Sydney. I'm here on behalf of Assisted Living Locators, Dave Holder. You don't know him or not. We're a senior living referral service, so it's free to the client. Think of us as kind of a realtor for senior living communities. So assisted living, independent living, memory care, 55 and older. We're here to navigate you through the entire process. So.
And her boss is up here in the corner, Dave Holder, and he is the most genuine human being, and he really helps you understand the communities that are available to you. He will work with you and make an individualized recommendation. So we love Dave. Before you leave today, I want to just remind you that aging bodies change, but being uninformed is optional. So thank you all for coming today. Health literacy isn't about being difficult, it's about being present in your own care, in your own journey. So I commend you for being here today. Please stop by, meet our education partners, get them in your phones, so if you need them, you have them. Or schedule some time to learn more about what they do. They are very generous with their time. I want to remind you to RSVP next month, or even next week if you want to hear from Jenny. When you RSVP, it makes the registration smoother. It's fastly becoming one of my least favorite things about